Hello, class. Thank you for listening to my community plan for community health nursing. So let's begin. So this is just a quick overview. We'll be talking about the introduction, the definition of a community, the windshield survey that was conducted, all the data, partners, resources, health diagnosis that was developed for the community, which relates to the project, and then health plan, and of course, how we're going to evaluate those methods. So for introduction, this is my presentation and part of my community plan, so me, Amber Eddy. And the purpose of it is to explore some elements that are considered during a community assessment and relate them to proposed community plan interventions and goals. And this is all taking place in my hometown, Fayetteville, North Carolina. Okay, so what exactly is a community? Understanding and knowing a community is a vital piece of information that can help shape a better community. In this PowerPoint, we will be discussing the community of Fayetteville, North Carolina. The basic definition for a community is a group of people living in the same place or having a particular characteristic in common. For the purpose of this assignment, we'll be discussing the community in terms of physical location. Fayetteville is a city in North Carolina and is located southeast of the state, known as the Sandhills. The city is built on the Cape Fear River and is home to Fort Bragg, which is the largest military base in the United States. Fayetteville resides in Cumberland County, and the community borders are very distinct. Fayetteville is a large metropolitan city, but is surrounded by the countryside. There's a stark difference between the country areas and the big city of Fayetteville. To better understand a community assessment is done. The community assessment is the process of identifying the strengths, assets, needs, and challenges of a specific community. Community assets are the skills, talents, and abilities of individuals as well as the resources that local institutions contribute to the community. So after an assessment is done, you can then compile a plan based on those community needs. So in Fayetteville, there are three majority races: Caucasians at 36%, African Americans at 40%, and Hispanics make up 13%. The average median age is 30 years old, and Fayetteville has an equal ratio to men and women. The numbers reported are due mainly to the composition of the large military base. And with a expansion project that they are currently working on, it's a 10-year project, the number of people is expected to rise through 2030. The U.S. Census report states that in 2019, the population of people 65 and older make up 12%. So compared to other cities, that's actually a very large number. I believe part of that is also related to the large veteran population that we have. So to understand a community is the first step any public health nurse must take before a change can be implemented. So Fayetteville, North Carolina is a large community with a clear economic divide that puts at-risk populations like the elderly at risk for health disparities. With the aging population, common health concerns are cognitive decline, balance issues, nursing facility placement, and hospitalizations. These factors contribute to pressure injuries, which can increase medical costs and involve more hospitalizations and are terrible for the individual as well as the community. So the aging population will be the focus of the community plan. Fayetteville's main healthcare system is Cape Fear Valley. Also includes a specialty hospital that is wound certified and one of the few wound hospitals in this region. The hospital receives many patients from all over the southeast part of North Carolina, and even some South Carolina because it's extremely close to that border. The healthcare system has a wound care protocol, but the number of complications related to wounds continue to climb. Pressure injuries and wound care affect the whole community. The cost of healthcare rises, available beds get taken up, and patients are at higher risk for infections due to hospitalizations. Reoccurring pressure injuries and wounds are costly for the healthcare agencies, and when a patient receives a preventable wound during a hospitalization, it becomes the fault of the healthcare organization and they incur all cost. Community partners are vital for any research or project in a community. Partnerships are defined as a relationship between individual groups and organizations in which the parties are working to achieve a joint goal. The goal of this community project is to implement training on new wound care treatments. This requires a partnership with the clinical educator at a local hospital. Brittany is the nursing educator at Highsmith Rainey. That hospital is the wound care certified hospital and it's a teaching hospital. Brittany oversees all clinical education and implements training programs as needed faculty-wide. The hospital is certified for wound care, so they take a big interest in wound care related devices. And Brittany works with medical representatives for in-service training and with new products when it hits the unit. Medical representatives are a great partner because they offer a specialized knowledge to the products being used on the floor. Also, the two products that my project is working with is called Actigraph and Bosch. We'll talk a bit more about those in a little bit, but they are both newer wound products. So the hospital is part of a clinical trial. So after compiling the demographics, the resources, and the assessment, the community diagnosis that best fits this community is risk for impaired skin integrity among Cape Fear Valley hospitalized senior citizens related to knowledge deficit among nursing staff as evidenced by the increased incidence of pressure injuries and wounds. The elderly population make up a large percent of the community, and the elderly are the most susceptible to wounds, healing disorders, and chronic wounds. The biggest health risk is ineffective health maintenance that leads to pressure injuries, and the majority of the patients, 77% with chronic wounds, are cared for in a community setting. So thus a large population of nurses' time is spent in providing wound care. And once an order is placed and signed by the provider, 2 copies are made. The first copy goes into the medical chart, and then the second copy is placed in a color folder that is exchanged during shift report. The wound care sheets explain the order, interventions, and the dates to be completed. There is a sign-off sheet that must be signed after each treatment. This system works great to keep nurses accountable for wound treatments and gives a ledger of when the treatments were done or due to be done. The wound care sheets go into detail on what exactly needs to be done and how. Orders are reviewed and processed by the wound care nurses. The nurses are responsible to educate patients at the bedside during wound treatments. The nurses will be trained to educate the patient while doing wound care treatments. Education will be centered on the patient's main problem. If the patient has an existing wound, then education will be focused on wound healing and nutrition to help the wound care process. If the patient is at risk for pressure injuries or wounds, then education will focus on preventive measures like turning frequently or wearing adaptive devices properly. Education will be verbal with a hands-on demonstration while providing care. This will be implemented on their care plan as well to make sure that the care plan was being followed through. So between teaching, educating, and implementing the 2 new products, that together makes the health plan. Interventions for the community. In order for them to be effective, we need active participation, and this will be for both the nurses and the patients. Ethic committees are really great to have because the elderly is such a high-risk population. So to implement a fair and ethical community plan, ethical committees are great for making determinations for high-risk populations. Also, regulatory agencies are great because then we have to make sure that we're following all federal, state, as well as facility programs and obligations. And then, of course, training. All the nurses and the patients will have to be trained in order for interventions to be successful. So the wound care program will be evaluated in numerous ways. The first way will be through a patient questionnaire. The questionnaire will be given to every patient that participates in the focus. The question will be given to every patient that participates. The focus of the questionnaire will be if the teaching was effective. The second way the project will be evaluated is by the online module pass rate. At the end of each lesson, there is a generated exam based on the content that requires a grade of 80 or better. One way to do a comparison is to look at last year's online modules that did not have the new teaching protocols or in-services and compare that to this year's pass rate and the wound care project. Another way the intervention will be evaluated is by wound healing rates. The unit keeps track of all wounds and treatments. Implementing the wound project will allow the organization to compare the project on the floor for 3 months. Then they'll do a chart analysis. If the program is successful, then it will become part of the hospital policy and procedure. So in summary, the community health is really important for the overall health of the populations. Although there are many problems that a community can face, a public health nurse must be able to focus on one problem and formulate a plan and then implement it. The community of Fayetteville has a large senior population, and pressure injury is a major concern. So with the numbers of wounds and complications related to wounds, the community plan and project is focused on the education of nurses as well as patients, and implementing the 2 new products that will help in treating existing wounds. The plan will take 3 months to complete, but evidence-based practice shows that these implementations could have a positive result in the healthcare organization, therefore in the overall community. Evaluations will take place and look at different areas before the wound project is adapted into Highsmith-Rainey's official wound policy. So thank you for listening to my community plan. Any questions, feel free to write in the discussion board. Bye.